My name is Edith Boyle, President and CEO of Lifebridge Community Services. Implementing trauma-informed practices in settings like healthcare, education, and law enforcement better supports individuals who have experienced trauma. Local agencies in our community are implementing these important trauma-informed practices in their valuable services, and we're excited to highlight some of those partners here today.
So BASIC, we are located in Bridgeport, Connecticut. Smart, charismatic, inner city students that are just totally awesome, and it's great to work with them.
We developed a partnership with the public high schools in Bridgeport. I am running social emotional learning to help the kids develop a sense of their feelings and emotions within themselves in order to have a better relationship with others as well. The intended outcome is to help decrease the impact of trauma in our community. So we know our children go through vast amounts of trauma in our community. So with this curriculum, we want to help them develop a sense of themselves in order to recognize what's going on around them. And if they are aware of that, they can combat the negative thoughts or the negative behaviors that they may encounter and replace them with positive ones. I also use the tool School Connect, which we use to teach the curriculum of social emotional learning. It gives me some pointers and go-bys as well to help me relate with the kids.
Wakeman works with 4,000 3 to 18-year-olds every single year, and our programs and services include academic success, health and well-being, character and leadership development, and life and workforce readiness. At Wakeman, we understand that we aren't the expert on everything and that we need to work together. We have provided families and caregivers and our youth members with access to resources from other organizations, Lifebridge being one of them. In the last year, we've provided multiple caregivers with access to therapy and other resources through Lifebridge. From my perspective, it truly starts with the training of our staff and volunteers. Everyone who comes through our doors is onboarded and oriented with trauma-informed practices.
At the Child and Family Guidance Center, we're committed to cultural humility. This means that we treat all clients with respect and compassion, regardless of their background or circumstances. Nearly 90% of our clients come from communities of color, and 85% face financial hardships. This means it's really important to understand their backgrounds and to listen to their stories. So it's very important for us to take an approach of cultural humility because it helps to build trust. Our clients oftentimes come from backgrounds where they have experienced a significant amount of trauma. This may be physical abuse, sexual abuse, or they may have even witnessed domestic violence or violence in their community. This impacts the way that you see the world, and it's important to be able to just listen and understand where people are coming from, because that builds trust and allows us to make a lasting impact. So part of the way that at Child and Family Guidance Center we approach cultural humility is, number one, having over 60% of our staff being bilingual. This helps people to be able to get care in their own language and from providers who understand their cultural background and traditions. It's also important to make sure that you teach all providers about cultural humility and the approach to taking care of patients who have experienced trauma.
StreetSafe is a nonprofit organization that works to reduce gun violence. We work with some of the most high-risk youth and individuals in the city of Bridgeport. We have 24-hour mentoring. We answer hospital calls. We advocate for the youth at home. We advocate for them in court. We advocate for them pretty much everywhere. Whenever there's a shooting or a stabbing in the city of Bridgeport, Hartford Healthcare or Yale New Haven, which is Bridgeport hospitals, they call us and we report to the hospital for de-escalation and support for the victim, because typically we know that the hospital, they just want safety and the victim just somewhat want answers.
We're both from the city of Bridgeport, so we go through the same challenges. We've been through the same challenges that most of these kids are facing. So for us to kind of have that relation makes it even better. And then we're able to grasp and to kind of get their attention, showing them the other side. You know, most of these kids haven't been out the city of Bridgeport, or they haven't even been off the corner that they go on every day. So for us, me and Aquil, we've gone through these battles as well and these challenges, and we've overcome them as well as the other members that's on the team.
If I had one takeaway, my one takeaway is that we continue to do this work. And when I say we, I'm talking about us as a whole, as a community, as a society, because there's young people out here who actually need the help. And if we don't bring it to them, who will?
For me, I like to network and I like to get other resources out there. So any event I go to and I'm representing Street Safe, I try to tap in with other resourceful teams or organizations that do the same or similar work. For instance, with SEL, we go into the schools as well, and we speak to the kids that are part of the SEL group. We do speak to the kids that are part of the hub. Catalyst is the branch is the whole house, but under that house there's other organizations that, as an outreach worker, you try your best to kind of find what can fit for that kid. For us, it takes a village, like they say, it takes a village, and working with Street Safe is not, you may just see me working directly with a kid, but there's other organizations that's out there that do similar work that we kind of love to, partner with, like Lifebridge.
I'm Tia Reed, Senior Director of Behavioral Health Services for Lifebridge Community Services. Today we have the opportunity to listen to partners in the community implementing trauma-informed practices. Trauma-informed practices means listening to our clients, giving choices, being patient, and offering trust. We're looking forward to continuing the work that we're doing here in Bridgeport and leading the way. I am eager to work with each of you and look forward to our continued relationships. Thank you so much.